Dr. David Kulla here with Synergy Wellness, Chiropractic and Physical Therapy. Today, this video is about the Epley maneuver. Now, the Epley maneuver is for vertigo, dizziness. Some people get the diagnosis of meniere's disease. Okay, now it's important to understand and differentiate between the types of vertigo or dizziness. Now, you have two types. You have peripheral and you have central vertigo or dizziness. Now, it's also called BPPV, benign paroxysmal positional vertigo. It's a tongue twister, that one. But what it means is vertigo, dizziness caused by a sudden motion or movement, a quick movement, head to the side. If you have dizziness or you get lightheadedness when you move in a certain way, that means this technique will probably work on you. We have about an 84% success rate with this maneuver. Now, it's important to understand also you have three semicircular canals in the ear. You have an anterior, a posterior, and a horizontal semicircular canal. And those semicircular canals have calcium crystals on the ends of them, and sometimes they get loose, and you have tiny little nerve endings along the middle part of the semicircular canal that get stimulated when some of those calcium crystals are loose, causing that sort of lightheadedness and that dizziness. So this only works, this Epley maneuver only works for anterior or posterior issues with the semicircular canal, not the horizontal canal. I'd say about 95% of cases of vertigo involve the anterior or the posterior semicircular canal. So that's the good news. You have a 95% chance of this maneuver helping you. And sometimes we have to do this maneuver more than once. So we're going to go ahead and show you the maneuver. Priscilla here has agreed to let us show you this maneuver. She's from EmpowerMeNYC.com. She's a health coach and helps a lot of people out. Takes a unique approach between psychology and coaching to achieve really amazing results with people. But enough about that. Thanks for helping us. Now, what we're going to do is we're going to check to see if she has any dizziness. And we also want to check the range of motion in the neck before we do this maneuver. So we're going to have her turn her head 45-degree angle this way. And 90-degree would be all the way to looking right over her shoulder, her chin to her shoulder. So 45 degrees is right in between. And then we're going to have her bring her head back. And I'm just going to take a look at her eyes. And do you have any dizziness? No. Okay, and then I want to look for nystagmus, flickering of the eyes. You'll notice it right away when you see it. And then we're going to have you go back to neutral and then a 45-degree angle to the left. Okay, just like that. And then look back. And same thing here. She's able to make that motion, no problem. You don't have any dizziness there. So now we're going to test her for either a right or a left-sided issue with the semicircular canals. We want to make sure we're treating the right side with the Epley maneuver. So she has dizziness. She has had vertigo in the past to the left side. So we're going to first test the right side. So what you want to do is you want to lay, find a table and lay towards the end of the table. And what she's going to do is she's going to turn her head again 45 degrees, just like that. And then we're going to have her lay down really quickly, okay? So really fast. She's going to lay right down on her back, okay? And then at the bottom, we're going to bring her head down or back 20 to 30 degrees. We can even start that now. So bring it back about 20 to 30 degrees, all the way back there. Good. Now go ahead, quickly lay all the way back. Good. And any dizziness? Okay, now if she had dizziness, this is the right side. So she usually gets it on the left side. But if she had dizziness here, what we would want to do is just make sure she's in this position until the dizziness or the lightheadedness or the room spinning, until that stops, or 1 minute, whatever comes first, okay? And typically it stops within 10, 15 seconds, sometimes 20, 30 seconds at most, okay? So it's not gonna typically last for a whole minute. And we're also looking for nystagmus for her eyes to flicker like that. And no problems there. So we're gonna bring her up. Okay, now we're gonna test the left side. And we're gonna turn the head. Now she's not episodic right now. She's not having any symptoms of vertigo, so we're gonna pretend, okay? And this is testing the left side. She's turning her head left 45 degrees, bringing the head back 20 to 30 degrees, and she's gonna lay down really fast. Good. And any dizziness there? Okay, now again, if she had some dizziness here, you would have her hold this position and hold it for, again, until the dizziness or lightheadedness disappears, or a minute. And then from this position, we're gonna have her slowly turn over onto her left side while keeping her head turned at a 45-degree angle. So in order to do that, I'm gonna have to pull this out and give her, and turn your head 45 degree, and we're gonna have to slide this under with her head looking downward at a 45-degree angle. Good. And same thing, if there's any dizziness, you're gonna hold this position, have the patient hold their position. If you're doing this at home, you just hold this position until the dizziness goes away, or a minute, okay? And then from this position, she's gonna go ahead and push off the elbow in the hand, swing her legs forward and sit up slowly with her head still turned to 45-degree angle like that. Good. And you do not want to look down after you do this Epley maneuver. And then slowly she's going to turn her head back to straight. And again, you do not want to look down. That means stay off your cell phones for the rest of the day. Stay off your computer for the rest of the day. You could also get a neck collar if you want. If you have a hard time staying off the technology, that's another solution. And you should wear it for the rest of the day. You can do this technique at the end of the night if you want, and then just go home and lay down. Make sure you don't get a big pillow under your head, pushing your head forward like this after you do the Epley maneuver. Also remember that sometimes you have to do this technique, this maneuver, more than once. Sometimes twice, in a worst case scenario, 3 times. If your vertigo and your dizziness has not cleared up using the Epley maneuver, but there are other techniques to help with vertigo and dizziness. I wrote a great blog article about it. You're free to check that out. I also did a video on somebody that has a central nervous system vertigo. So there is peripheral and central, and there are treatments, different treatments, depending on the type of vertigo you have. So it's really important to figure out what type of vertigo you have, whether it's BPPV or a peripheral vertigo, or whether it's a central vertigo. And depending on that, we tailor the treatment to what works best, obviously, for the type of vertigo that you have. If you have any questions or concerns, feel free to comment below. And I hope you like this video. Please give us a thumbs up and subscribe to our channel so you get some other videos that we're putting out every week. And I'll see you next week. Thanks.